Endocrine system questions 1. 1. A client with diabetes mellitus is scheduled to have fasting blood glucose level drawn in the morning. The nurse tells the client not to eat or drink after midnight. When the client asks the nurse further information about fluid and food intake, the nurse clarifies by stating which of the following would be acceptable to consume before the test. 1. Water. 2. Coffee without any milk. 3. Tea without any sugar. 4. Clear liquids such as apple juice. The correct answer is 1. Water. 2. A client has abnormal amount of circulating thiramine and thyroxine. The nurse understands that the client may have deficiency of which of the following dietary elements. 1. Calcium. 2. Magnesium. 3. Phosphorus. 4. Iodine. The correct answer is 4. Iodine. 3. A nurse is monitoring a client with Graves' disease for signs of thyrotoxic crisis. Which of the following signs and symptoms if noted in the client with alert knows the presence of this crisis? 1. Pallor and tachycardia. 2. Fever and tachycardia. 3. Restlessness and bradycardia. 4. Agitation and bradycardia. The correct answer is 2. Fever and tachycardia. 4. A client has been diagnosed with Cushing syndrome. The nurse would assess this client for which of the following expected manifestations of this disorder. 1. Hyperkalemia and peripheral edema. 2. Moon phases and tunical obesity. 3. Hypertension and dizziness. 4. Anorexia and weight loss. The correct answer is 2. Moon phases and terminal obesity. 5. The nurse is providing instruction to a client with a diagnosis of Addison disease regarding the administration of prescribed glucocorticoids. The nurse would instruct the client. 1. To avoid taking the medication if nausea occurs. 2. To stop the medication if side effects occur. 3. The minimal side effect will occur from use of this medication. 4. That an increased dose of medication may be needed during this time of stress. The correct answer is 4. That an increased dose of medication may be needed during times of stress. 6. A client with medullary carcinoma of the thyroid gland has an excess function of the C cells of thyroid gland. The nurse interprets that this client is primarily at risk of having abnormalities of which of the following electrolytes? 1. Sodium. 2. Potassium. 3. Calcium. 4. Magnesium. The correct answer is 3. Calcium. 7. A nursing instructor asks a nursing student to identify the risk factor associated with the development of thyrotoxicosis. The instructor determines that the students understand the risk factor of the student states that which of the following clients are at risk for thyrotoxicosis. 1. A client with hypothyroidism. 2. A client with Graves' disease who are having surgery. 3. A client with diabetic mellitus scheduled for debridement of foot ulcer. 4. A client with diabetic insipidus scheduled for diagnostic test. The correct answer is 2. A client with Graves' disease who is having surgery. 8. A client has turned to the nursing unit following thyroidectomy. The nurse notes that the client is complaining of tingling sensation on mouth and the finger and the toes. Based on this assessment finding, the nurse would next assess the result of which of the following serum laboratory studies. 1. Sodium. 2. Potassium. 3. Calcium. 4. Magnesium. The correct answer is 3. Calcium.